would you like to work on today?
Well, today will probably be the my hip area.
Yep.
Well, I sit all day, most of the days. At computer, we had a session on the shoulders before.
Yep.
Great. Now the hips. I'm guessing because I'm not moving a lot, sitting down a lot. I'm not a runner or I'm not a cyclist. I do a lot of walking, so I'm guessing that's good as well. And I do quite a bit of yoga as well. So I make sure that I do work on the hips and releasing certain areas, but still, it can get tight.
Sure.
And I can also, and sometimes I'll even roll when I'll use the roller, IT band. So I think I'm taking care of my hips, but still there's some tightness in there.
Okay, so the first thing to understand about hips are they're very mobile. Okay, they like to move. They don't like to be smashed and bashed and crunched and twisted too much, but they like to move. A bit like the shoulder. The shoulders, hips don't like to sit there in the wrong position. So what we do is we examine the hip, look at the hip, look at why it might be stiff and sore. Okay. So the idea behind the hip is it allows us to move, but sometimes when we move the wrong way all the time. We keep repeating the same process, like getting out of a chair. So we sit all day, we get out of the chair in one direction. We sit back down the same direction. So if this happens 20 or 30 times a day, 5 days a week, all that time, something might cause pain. And there are a lot of structures around the hip, i.e. muscle, fascia, bursa, joint, blood vessels, nerves that don't like being stagnant. So we like to unlock this, and by unlocking it, by using osteopathy, myofascial release, acupuncture, it allows the blood to flow, the chi to circulate, the energy, we get the movement back, and the hip can start doing what it's meant to do, is support and move, which is what it's all about. So what we'll do is we'll have a quick look lying face up first. Then what we might do is roll on the side and just have a look at the hip, go through some ranges of movement, and maybe talk a little bit about the larger muscle groups on the top of the hip, which are our prime movers, and link it up with the tibial band, which is that band of tissue down the side of the leg from the hip down to the knee to the foot, and see what's going on along those lines of pull, lines of energy that might need to be unwound, undone, released, which can then take away the pain. How does that sound?
That sounds good. So that means we're focusing on the hip area. Eventually we'll focus on the legs and all the way to the feet, because that can also affect, if the structure or the base is wrong, that could affect the hips as well. I'm guessing everything can affect the hips. So we'll work on hips first.
Sure.
Release that, I'm guessing, and eventually we'll make our way down all the way to our feet and our ankles, because we're walking on our feet, our ankles, and quite a few people have had injuries. And we'll mention injuries as well, Steve, as we go along, because some people is just doing too many things for too long. Some people unfortunately had injuries, and that all converging histories, I guess, and that all adds up, doesn't it?
Well, it's important to realise that when we're born in one shape. We're a C shape. When we start to crawl, we start to develop secondary curves. All of a sudden we start to crawl and then we stand up. So all of a sudden we're weight bearing on something that's pretty malleable, and that's where we get this learned process of standing and movement. It starts at a very young age, continue on through growth, puberty, adolescence, adulthood, sitting behind a desk, studying, playing sport, has a huge effect on how everything works. So the foot, lots of bones in there. Lots of muscles attaching, long muscles, short muscles, ligaments that have a huge effect on what happens above. So the knee, so we've got one joint that does this. The joint above that, the knee, really only has one or two movements, flexion, extension, and a bit of rotation. Then you've got this mobile joint higher up. So there's this, it's not like they're all doing the same thing, they're all trying to adapt and help us move, help us sit, help us get around, but if something's jammed up or stuck, the body will rebel and will start to compensate by maybe leaning to one side or having a shorter stride, or we take painkillers. We don't know how to deal with it, but let's have a look and see what's going on.
Perfect.
Yeah.
Okay.
So I'll get you to lie on your back first.
So everything slowly.
Slowly.
No magic pill.
No.
Well, there are pills, but no magic one.
And I get asked this quite a bit. Can you fix me in one treatment? Possibly. I'm not Houdini, but sometimes you think, well, you can. But as we said before, you can actually link the hip up with the rib cage, with the knee, and with the ankle. So first thing is we just have a look at both sides. So we're looking at right and left. If one side is problematic, we then look at the side that is better, and we just have a quick look and see how it's all moving. We have a look at the pelvis, so we can just have a feel of what the pelvis is doing, rocking it side to side. We can grab the leg, we can take the leg up into a nice easy position and find straight away there's restriction. Doesn't like to go into too much flexion, doesn't like to rotate too much, which it should be able to do. Let's see if it wants to drop out to the side, bit of restriction. So a lot of these larger muscle groups through the groin, the adductors, the thigh, ITB, hamstrings, and the hip will restrict this movement. Okay, so we're just having a feel of what's going on, and obviously if there's any pain you would say something. If we examine the other side, there would be a bit of a difference in how they moved, left and right. There's usually a slight difference, and then just by the leg being held in this position and just allowing it to move gently. I'm doing this quite simply by just holding the leg up, just taking it through some gentle movements. And what we find is by taking into a larger range of movement, it starts to relax and give way. So we're encouraging these larger muscle groups and some of the smaller ones behind the hip to move. Obviously we're off weight bearing, so the muscles aren't supporting and holding and have to do too much work. But it's giving them a chance to rejuvenate after being sitting in a desk for too long. We're giving it a chance just to rejuvenate, feel comfortable. We're not causing any grief. We can take it out into a nice range. At the same time, put a bit of traction through the hip. Keep the knee there. We can work into the front of the hip flexor joint, front of the hip here, psoas. We can even work into the abdominal area. The abdominals are usually causing some issues as well because they attach onto the pelvis. Straighten the leg, take it up, see how far we can get, take it off, pull it back up a little bit more, take the knee, take it out, rotate it, and at the same time we can do some gentle stretching through the groin, through the front hip as well, and then we drop it down. Any questions so far, Max?
So some of the areas, the problematic areas for people that sit a lot. So would it be, for example, a lot of men, tight hamstrings? And tight hamstrings can cause, I'm assuming, lower back problems, all kinds of problems. So is the hamstring and any other ones that can really, as far as your experience in treating a lot of people, come up often?
Hamstrings are obviously a large, long muscle group, and they obviously start at the back of the hip. If you want to take it a little bit further, they actually start through the feet all the way through the hip, top of the head. So it's a continuum of energy and fascia, which once it gets restricted, it's very hard just to focus on one area to release that. You then identify some of the hip rotators, such as piriformis, the gemelli in here, which are also quite short muscles, but they attach to the pelvis and sacrum, which is the large triangular shaped bone in between the two hip bones. So that is another area that can have an effect on the hamstrings. And a lot of these muscles overlap.
Yes.
So when we're sitting in a chair, everything shortens. The abdominal area shortens, the psoas shortens, the hamstring shortens, then we're getting up and twisting quite a lot, which is incorporating these smallish muscles to rotate the hip and force getting out of the chair. We come back to the chair, we do exact opposite. We sit down and we twist back into the chair. Okay. So what's happening nowadays, everyone's talking about the stand-up desk.
Yes.
Which is fantastic, but it's like a chair, you have to learn how to stand. So some people get the stand-up desk and they'll stand all day. After a few hours, they're not used to standing up, so they're going to get uncomfortable. If their back's tight, hamstrings are tight, it's okay standing up, but you have to know how to stand.
Right.
Okay, and what you can do while you're in that workspace to take the pressure off your lower back, which might be going not real comfortable standing up. What do I do about it? I might sit down again.
Okay, so it could take time to move from a chair to a stand-up desk. So you might want to do it a certain period at a time, an hour or two at a time,
Sure.
and then build it, because you're right, the lower back would...
I like to think they could do both. They could maybe start with an hour standing up, then go back to the chair. Go back after lunch, I might stand up for an hour and a half, go back to the chair.
Okay.
So that'll be week 1. Week 2, 2 hours in the chair, stand up for an hour and a half, and play around with it a little bit. Okay, so there's all this ways. And in meetings, I suggest get a Swiss ball. So when you're in a meeting, instead of sitting down, I mean, you can obviously have a meeting standing up, even getting a Swiss ball, and while you're talking taking notes and having a meeting, you can still be on a Swiss ball, which is allowing you to move the body.
Yes.
While you're working, you can still talk on the phone on a Swiss ball.
Okay.
Or I get people when they're standing up, excuse the foot, when they're in a meeting, putting the foot up on the table. So you can still present something while you're doing a stretch. Some people complain it looks a bit weird, but hey, you feel better after.
Yeah.
Next time you have to make a presentation, or in 5 minutes' time, you might put the other leg up. You can still talk at a desk when you lean forward and do a lunge.
Okay.
And you can swap sides. But you have to learn these things. So what we're doing with those techniques is to encourage movement through the hips. So the groin, lower back, the posterior part, the outside. It just gives the body a break. Okay, after being sitting for so long, you get in the car, you go to work, you sit at the desk, you get in the car to go home, or the train or the cab, go home. What do you do then? Sit down. Okay. The opposite being we get home, dump everything, and then go out and run.
Yeah.
Or we go out and paddle. Or we go out and box for an hour and a half, which is fine. But if your body's used to being in this sitting position, then all of a sudden you're on a paddle, and you're paddling, or you're swimming, or you're doing something. It's good, but it's a little bit too much. Okay. That's where yoga comes in. You might say, right, I won't do that tomorrow. Tomorrow I might go down the beach and do some yoga. Or I might sit at home and do some yoga. Or I might have a day off.
And that's
and
an interesting...
do nothing.
And that's a good point, because a lot of people, I think that they have to do something every day.
Yeah, exactly.
And I think these, not the athletes, I think the athletes understand, or they're told by the coaches to have days off and whatnot. But I find that some friends that might be runners or they like their gym, they will do 6 or 7 times a week, and they don't rest.
And 9 times out of 10, you ask them, how do you feel? I'm exhausted. Okay, so their way of dealing with life is to go into triathlons, go into races, swim every day, cycle every day. Let's do a 180k cycle. I'll treat someone on a Saturday, can I go and cycle 180 kilometres? I said, you can, but I wouldn't recommend it.
Okay.
Have a bit of space, bit of time off, go for a walk, have a swim, whatever you got to do, but just give your body a bit of a break, because it's also important for the body to rest.
That's right.
As you get older, you start to learn this a little bit and apply it to your life. You start to get a bit more savvy about what really is good for you, because you really have to look after yourself.
That's right.
If you're going to help other people, you've got to look after yourself.
Hence the balance, I'm guessing.
The balance, big word, balance. Being mindful of balance and understanding what it is, how it works, getting used to it. It takes a while. If you've been in a situation or situations where you're busy, it doesn't happen overnight. That's where this work we're doing is really important, to help people cope with that change and say, look, it's okay to not do this today. Make a change. Why? Here's the reasons. After a while, it might be a few weeks, it might be a few months, they start to think, that day off was fantastic, I might do it again next week. I might go for a walk and not run. I might go and meditate, I might go and sit and look at the ocean. So this is something that's evolving slowly in life, people's lives. They're starting to get a feel for it's okay to do nothing. But it's important to be encouraged by the right people. Yeah?
That's right, yeah.
You don't tell them they have to, but in my circumstances, this is what I do and this is why it works for me. Try it.
Yeah.
So what I'm doing here, I'm just working on the front part of the hip, just getting to the side of the hip, down into the ITB, which is obviously quite tight, but it's pretty tight in everybody, varying degrees. It's normal. And by freeing up, this is, as we spoke about with the shoulder, it's a continuum of energy and fascia and muscle and tissue that goes right down to the foot. So if I'm working on the thigh, it's also going to affect the hip, the lower back, the knee and the ankle.
That's right. And another important one, I think, as well, is the calves, calf muscle. You know how you just said the hamstring. You know, the hamstring really extends all the way to the foot. Well, I'm guessing the calves are a bit of the extension of the hamstring that
Sure.
will get down to the ankles, and the calf injuries we hear of, or people will say, "Oh, I have tight calves." And I know I had, Steve, you helped me years ago. I had a lower back problem, and it was because of my tight calves
And feet. So the
and feet,
Yeah.
and that was causing my lower back pain.
Sure. So we're just freeing up the area around the side of the knee, which is where a lot of people complain of problems. After a while they start to get this catchy feeling, going up and down stairs, getting out of a chair. It feels like there's this sharp pain. And a lot of that is due to this fascial band that runs on the side of the thigh, down to the knee, through to the leg. And it allows the knee joint, the side of the knee joint to work, and it also allows the kneecap or patella to track properly into the leg when we're using it. Because the patella it's a free bone, but it has a huge effect on, if it's in the wrong position when it's tracking, it can cause a lot of problems on the lower part of the leg, front leg, and give us a real dull ache or some sharp pain. And there's no need to panic. Sometimes just doing release work will free it up, allow it to work, allow it to move without the need for any medication long term or serious treatments from surgery. So it's always nice to think conservatively, apart from an acute injury that's quite severe. That's where we come in. We look at it and we assess it and see what's going on. So we're just moving back up the top of the thigh into the front hip flexor, which is quite small but has a huge impact on our back, groin, thigh. Okay, I'll just get you to push your leg up into my hand gently and relax.
And do you find men, hip flexor is another one, do you find that men tend to have
Just line your side.
more hip or hip flexors a bit
Issues?
tighter? Yeah?
Yeah.
Yeah.
Just line your side facing that way for me. That's good.
And is that a structural, is it because of the, what's the difference then, why a man would have often tighter hips? Is that because we don't actually take as good care as the women would do, or is it a structural
If you
one?
think about, I'm not being sexist here, but if you think about what a guy does when he's growing up, okay, what sports he plays. So the soccers, the AFL, the footy, athletics. I mean, I know girls play athletics or do athletics, but back in the old days it was soccer, football, one-sided sports. Okay, they might go to athletics and do high jump, triple jump, long jump, which means taking off from one leg, landing on the other leg. And if they do that at a good level, they'll be training and practicing all the time, maybe 3 or 4 times a week. Same with soccer. If you're a good soccer player nowadays or a good rugby league player, you get spotted, get taken up by a coach introduces you to someone who's a better coach, state level or local level, and you start doing more training on top of everything else. So that's one issue that, and if you're kicking with one leg all the time,
Of course.
and you're on the right wing and not the left wing, so you've got to look at all these factors that might be playing a part in what's causing the issue, apart from overtraining and skateboarding, surfing, running, jumping, riding a bike, all in a day. So
Ooh, that's a sore area. Ooh, this one. So that the glutes, is that right?
these are the small glutes on the side of the hip that
Yeah.
attach down through into the tibial band just here.
I can feel there's a. Ooh.
You get all sorts of I won't say the rest. There's some expletives that come out, but we can edit those.
And this is important when we're being treated or whatnot, if we have, our breath, the way we breathe.
Exactly.
And not to tense. For example, right now, the old Max would be tensing right now, whereas the more mature wise Max knows that it just means I have to breathe more.
Well, that's another thing. A part of this work is teaching people how to breathe and why they have to breathe properly. Most people come in, they don't breathe properly. You can watch when you're examining their neck or their rib cage or their pelvis, it's very shallow. So you encourage them and teach them by examining their rib cage and upper rib area and the muscles attached to it and the diaphragm, teach them how to breathe. After a while, they learn how to breathe and it changes their life. They become more relaxed because it has an effect on the sympathetic nervous system. They sleep better, they calm down, they realise that there's a technique there, I can use this technique, it'll have a positive impact, and it's just re-education. But when we're sitting all day, the diaphragm, rib cage doesn't like that. So we tend to shallow breathe, and if we're busy, we definitely don't learn how to breathe or take time out to say, I'm going to sit here and just sit upright and concentrating on the breath. 2 minutes, you can sort of reset the whole of the breathing capacity of the body. So what I'm doing here is now working, I'm just feeling what's happening in the lower back. So there's a lot of blockage on the side of the lower back, which connects directly to the pelvis. And that's just the back. Then the side and all these larger muscle groups around the pelvis here. So we can just spend some time releasing the rib cage to the side, which will have a huge effect on the pelvis here. Once again, we can ask Max to breathe in and breathe out. And when he breathes out, we can just get a nice stretch in through the rib cage at a higher level, which will then help the muscles, the oblique muscles running down into the pelvis. And we can sort of get both sides of the body or both ends of the body and just give it a nice release like this.
Even there.
Yeah.
Up at the front.
It is. Just lift up that leg. So we can just gently open up the pelvis by supporting a leg, taking it back. Max breathes in and breathes out. As he breathes out, we'll just take it a little bit further into extension. We can play around with the rotation here. Now I've got this leg fully supported, which legs aren't used to this unless they're lying down, but it's nice to give the leg a chance just to do nothing. It just, some people don't like it, some people can't let go, but Max is pretty good, so the leg's nice and heavy. We can take it into a nice extension, bit of abduction, take it back a bit further, and just by doing that it gives the front hip, ITB, glutes a chance to relax. I might just do a bit of acupuncture, just into these 2 points.
So the first step is always alignment, release, so just always easing in, I guess.
It's always easy. It's no, we like to take time because we can. It's something that I hate rushing treatment. There's no point rushing and saying, right, lie on your side, lie on your back, let's do this, let's put a needle in. If you give yourself time to do this properly, which is what these retreats are all about, it allows people to say, right, I've got all this time, we can just work on one area, we can go 2 areas, still got a little bit of time, we can do a shoulder, we can do a hip, work on the leg.
Ooh.
Yeah. Breathe in, out.
And again, I feel the usual initial release.
So we're going in, these are 75mm needles, that's 4 inches in the old scale, and we've gone in probably 70mm into because the tissue is very thick here, and in order to go deep, close to the bone, we need to get in quite deep with a needle because we're affecting the hip at a very deep level. And when you think about Chinese medicine, it's depth, which is very important as well. Breathe in again, out.
So that second one is in the glutes, is it? So
yeah, we're getting more towards the large glute,
glute
maximus.
Which is, the glute maximus is just walking and keeping balance. all the time from one leg to the other, there's always action going on, isn't
There's
there?
always something going on, yeah. And it doesn't usually settle down and relax unless it's allowed to. And now we'll just pop a needle in the ITB here.
Ooh, yep.
So this will be quite strong.
Ooh.
So you can actually feel the chi or the stuck energy through the needle. You can feel it palpating, but you can feel it through the needle when you're putting the needle into the tissue.
Is that right?
The beauty of this position is we can also come back and spend some time on the shoulder. If you wanted to, we could actually come back and revisit Max's shoulder, which was causing a few issues. So it gives us access to a lot of the rotator cuff muscles, but also these points around the shoulder blade.
Oh,
So
at the back there.
Yeah, so this is what I mean by you can work one area, but you can also influence the other area while they're in this position. And a lot of these areas...
Breathe.
So what we're on here is one of the sort of middle to upper rib cage areas where there's usually a fair bit of action and restriction. You've got to remember the ribs sort of start from the sternum and run around behind to the spine.
Yeah.
So there's a lot of muscle tissue, muscles in between the ribs.
Steve is very gentle, but you know the trigger points.
Yeah.
So
Trigger points are basically areas of blockage that, you know, in Max's body, in my body, in most bodies, there's thousands. But to isolate certain major areas, especially over the major acupuncture points, we can have a huge effect on 2 or 3 meridians at once, or the ones that are really causing problems. And there might be one in particular around the shoulder that just is standing out and needs to be released. But I like to work on the rib cage from the side because it gives you access to the shoulder, to the back, to the abdomen, to the lower back at the same time, instead of face down or face up.
right. And people are often relaxed on their side.
Oh yeah, if you support them with pillows, get them in a nice relaxed environment, and you know, enough support, people love it. So we'll just revisit.
Yes, please.
Breathe in, out.
So in the previous video, we worked on the shoulders, and Steve was very good at explaining tightness in the shoulders. So if you have a chance to see that video, it has very good information, doesn't it?
Well, as you said, we'll revisit the shoulder and take more time on specific points. We might work on the side of the shoulder. We might connect the neck and the shoulder and work on specific points that relate to, say, the wrist, elbow, shoulder, neck. We can highlight certain areas, but right now we're working in the back area of the shoulder where the rotator cuff muscles sit. So running from the shoulder to the side of the shoulder blade. I mean, there's a lot of area there that needs some work, but we don't have to rush things. We have time.
And as you said there, Steve, that was the rotator cuff, just like the hip, a great range of movement, and therefore it's a complex part where a lot of people have, you know, we hear the rotator cuff tear and rotator cuff injury. There's a lot of that, isn't it? Just the same way as there are in the hips.
Well, it's the rotator cuff, like we always say, doesn't like to be in the wrong position. The shoulder likes to sit where it should sit, which is nice and square in the joint. If it's not square in the joint, it'll compromise the shoulder, the ligaments attaching to it, the muscles attaching to it. And a lot of our emphasis on work is at the front of the body, so everything contracts inwards towards the sternum, towards the ribs. The internal muscles of the shoulder contract inwards, the large pec muscle contracts inwards. So when we start to open up and do our yoga and open up our bodies, we can then open up the chest, shoulder, neck, which then gives it a chance to move properly, encouraging blood flow, nerve supply, chi, movement of chi. So once again, it's all about how we stand, how we sit, how long we sit. If we're in that position for too long, 100% of the time we'll have issues.
And you've mentioned who should be doing yoga, Steve, and at what age should we start?
Well, my theory is we could start to be encouraged by our parents at a very early age. I would think even around 3 or 4. It's very simple it's not very simple, but if the parents are doing it and encouraging it, I'm sure a young child sitting in a lotus position or doing a downward dog or just sitting upright, opening up the shoulders in a simple pose, Tadasana. Once you start with those poses, keep it nice and simple, they get used to it. Then you start to introduce some forward bending maybe, or some very gentle back bending, upward dog, downward dog. So as early as possible. And then once you get into school, I think it should be part of the curriculum, school curriculum.
And what about in offices? You know, as we early 20s, we're still strong. You know, we get away with murder, I say. Then we get into our 30s. This is when we're starting to realize maybe a bit more injuries or tightness. And then our 40s and on. So I'm guessing office workers, people that sit a lot, or even people that do sports now are doing more yoga, but people that sit should open up, right?
To me, it just makes sense. I mean, most of the time in my clinic, I'm treating, but I'm talking about how they can help themselves. If they want some assistance, I'm more than happy to come in and do an assessment, which is what I do quite a lot of. Because once you go into someone's office, you can see not just one person, but 10 people. Once they see what's going on in there, and the office manager or the partner sees what's going on, they usually get encouraged to take it a little bit further. Right. So instead of going in for one, you can go in and say, right, let's look at the whole space, see what's going wrong. You've only got to ask the right questions and you'll get some answers regarding pain, discomfort, insomnia, weight, sleep disturbances, headaches, back pain, and you can identify issues straight away.
And you just mentioned 3 words: stress, headache, back pain.
Yep.
The S word, the stress, can cause exactly that, headaches.
Exactly.
And headaches, you don't necessarily need to take medication. Again, acupuncture is a way, isn't it, to release headaches?
Well, the Chinese have been using acupuncture for over 2,000 years for headaches, for all sorts of issues that they wouldn't hesitate to use acupuncture in most instances. Obviously, if there's something a bit more serious, you deal with it. But that's where your clinical work comes into practice, where you can identify, okay, should they be seeing me or should we refer them to someone else?
Right.
So you know, it's a very safe way of dealing with the body. But this is just a simple stretch. So I'm opening up the shoulder, opening up the hip, and just using the length of the body to open up. So it's a very strong technique. And at the same time, moving the shoulder into various ranges of movement, changing position. I can get Max to push up with the hip if I want. I can get him to rotate the arm. I can get him to pull the arm down towards his hip, which is a nice gentle technique which doesn't require much on my part, but Max gets to do a little bit of work which opens up the tissue as well, which is causing most of the problems. The same with the hip, same with the knee.
And the fascia. So fascia, the interconnecting tissues, I guess. This is where a lot of people don't realize how that keeping everything together is so important. This is why you mentioned the fascia quite a bit, doesn't it?
Sure. Well, fascia insinuates tissue. It gives muscle its shape, its strength, and its power. Muscle has strength, but it needs a supporting mechanism, which is what the fascia is. It's a connective tissue. It binds the muscle, affects the muscle to the tendon, to the ligament, and to the joint. So fascia, i.e. the tibial band, is a classic case. Lots of muscles attach onto the tibial band. It runs over 2 or 3 joints. If that's tight and it's not unforgiving, it will have an effect on the movement of those joints. The way we move, the way we stand, the way we sit, the way we run. So it's a very important component, and it can be done very simply by just using some nice gentle techniques with the breath once again.
And ourselves, this is where rolling
is very important.
Is very important, isn't it? Because we can do it ourselves. I mean, we'd love to come to see you every day, but the time factor wouldn't work too well.
Work.
So rolling, and incorporating that into our lifestyle, that is, if you, for example, if you watch the news, or you do something every night or every morning,
You sit upright.
you can do it as you doing something else, right?
Yeah, you can watch television. You can sit on the floor with a bolster, or sit on the floor against the lounge, and just practice some basic yoga techniques. You could grab a towel and have both hands and do a nice stretch for the shoulders. There's always ways, but you have to be shown these things. Okay? You don't read them. You have to be shown these things and break habits.
Yeah.
So, when you get an ad break, you might do a downward dog. The next ad break, do an upward dog. You might do a twist. So there's all these ways of utilising time better. Instead of going off making a cup of tea or having a chocolate biscuit or more chips, whatever, do some stretching.
And I guess the audio books are good for that, because I know I like multitasking, and because of time and listening to an audio book. And when I'm listening, I don't have to watch anything. So this is when I can actually do my stretches or roll, or just mindfulness time, just relax the body.
Exactly. So one of my basic techniques for a client, which I give them all the time, is just to sit there 2 minutes a day. You start them 2 minutes a day. So they have breakfast, especially retirees, they can sit there and just lengthen the spine while their shoulders are back. You explain to them, this won't happen overnight. Your shoulders have been sitting like that for 60 years. And what I do is I take a photo of their posture, sitting and standing, before and after. So you'll get them before. A lot of people come in, sore neck, sore shoulder. Once you get them sitting upright, nice position, teach them how to breathe, open up the chest, sit there, 2 minutes, and they go, that feels pretty good. Next day they might do 4 minutes. They might do morning and night. Then once they've got used to it, they go, this is feeling much better. I can walk upright. So you can walk upright and not let the body collapse. I can go to work, I can sit there just before lunch, 2 minutes. I can sit at the desk or go in the boardroom, upright. Get up against the wall on a bolster, sit upright, just have some time.
Instead of being on the phone, maybe.
Forget the phone.
Sometimes it's good to, and that's a very good point, Steve, is that we're always rushing from one place to the other. If we've got 1 minute, even down to 30 seconds, quickly we who's guilty? Quickly we pull our phone out for the latest Instagram post or the latest this or whatever you're into.
Yep.
It doesn't matter. And this is where sometimes we just gotta leave that phone in there. And as you're saying, maybe we'll just sit for a minute, straighten out, breathe. Now just relax for a minute.
Now we could take this the next step. If people can't get rid of their phones, they could have their phone in both hands, lengthen the spine, and still go up and do a nice stretch with the phone in their hand.
I like it. Well, it's sad to say, but at least it's a way of doing it, and that's a good point. So instead of always, and we always use the same arm often, right?
Usually,
because
yeah.
So at the office, Steve. So we need to get up. We need to, mix. So what we've talked about today was if we always do things the same way, if we always get up the same way, if we always sit down the same way, if we sit too long, and then always the same movement. So anything else the getting up, I guess, every 30 minutes?
I suggest every 30 minutes. Obviously, this is another habit that's very hard to change because they might be on a conference call.
Yeah.
30 minutes goes to 45 minutes. But what I suggest to people is there a boardroom in where you work? Is there a meeting room that doesn't get used much? Use the meeting room or the boardroom. Take your things in there, sit on the floor, not the chair, practice your yoga sitting on the floor.
Okay.
Or you go in the boardroom, there's usually a massive table and chairs. If you've got to make a phone call, go in the boardroom, one leg up on the table, upright, make your phone call.
And if it's not the table, if the table's too high, you can use a chair. You could just start by putting on the chair, then you talk for a while, right leg up, and then after we switch, left leg up. Because we're not trying, see what we're trying to do, and then people think yoga and everything else is take your hand, your leg and put it behind your head. It's nothing like that. Some people do it, they do it well. It's not recommended, but it's the little things, just a little more stretching for the adductors, for example, which mine is so tight, just and then the hamstrings, movement.
Well, you might just have your wrist out like that, so you can be in a meeting and you might just put your hand out like that, extend your fingers down, which opens up the forearm.
Yes.
Next time you do that side. Next time you do it that way. You know, you can play around with this. You can put your hand in behind your back, open up your shoulder. You can still make a phone call while you stretch, open up your shoulder. You can put your hand in behind your shoulder. You can put your hand behind your back and do a little twist, opening up your shoulder. So you can do this obviously sitting down, but it's doing, you're multitasking, you're sitting down, but you're lengthening and twisting, opening up your shoulder at the same time, and the hand. So that's something you have to learn, but that's why we're here.
Okay, so to be aware. So I guess awareness, movement, and we always talk about balance. So that is, the balance, we mean don't sit up for 4 hours. If you can get up, get up. And then the balance also is if you're sitting for a long time and then you're transitioning into a 2-3 hour run or a 2 hour session at the gym, well, you're going from being so tight to boxing or maybe not swimming or any other
skiing, surf ski or paddling or and then that's great that you're moving, but what sort of transition is that?
Okay.
So you've got to be careful with the transition, and sometimes it's a transition where things pop.
Yes.
So you've been sitting down, I'm going to go for a run, 100 metres, hamstring tightens up. So that's what I'm saying. I see that a lot. Calf, hamstring, lower back, hips tight, shoulder because they're on a ski or they're swimming, whatever they're doing. Ooh, that tightened up a bit too much. So this is all about awareness as well and education.
Okay. And another one can probably be, I'm sure you've treated people where they just went somewhere, they bent down to pick up a box, or they turn, neck, hip, or whatever. That would be due to tightness, wouldn't it?
Exactly.
Often?
Yeah, well, they might have a curvature of the spine they're not aware of, and the body tightens up. They turn against the curvature of the spine. All of a sudden, they don't even pick anything up. It's just that movement, then the back goes. So it's like the straw that breaks the camel's back.
Yeah.
It doesn't have to be big because you'll prepare yourself for something heavy. But picking up a pen, you make that movement, then the back goes. It was going to happen, it's just a matter of when.
Right.
Yeah.
So it's awareness. Well, Steve, thank you very much for one, the treatment, and two, for the all the good information. And then we'll keep another session. We'll focus, as we said, we're going to keep on moving down through the body, the legs, the calf muscles, the ankles, the feet, the toes. Toes are so important. Our arches on the feet, and then you've mentioned another good one, wrists.
Wrists are great.
So many wrist injuries, and we use our wrists all the time, and we're always contracting the wrist. So we should just the other way, or even on the ground at times, or just holding. And when we do this, the breath. If we're doing something that we're not used to, might be tight, this is when breathing is even more important, to make sure that we relax the body as we breathe in. So often what we'll say in yoga is that we take 3 to 4 seconds as we breathe in, and 3 to 4 seconds as we breathe out. And what that does is it makes us slow down.
It does.
Okay, so always remember breath. And until next time, thank you, Steve.
To be continued.
To be continued. Thank you.
Sounds good.